Hello, my name is Aurora and I'm a cancer survivor. And this channel is all about sharing tips and tricks that I have learned after 8 major surgeries and a lot of recovery to help you heal with more ease and comfort, whether you have a cancer diagnosis or some other major illness or surgery that is challenging you at this time. And so today I am going to talk about some of my adventures showering and performing personal hygiene with limited mobility. Um, this is one of the things that I really just did not get a lot of good advice on from anyone. Um, when I've had my first major surgery on my upper body, one of the things that the doctors emphasized in my pre-surgical visits was that I would not be able to push, pull, or lift anything over 3 pounds, and that I would not be able to lift my arms up over my shoulders for at least 6 weeks. So I kept wondering, how on earth am I supposed to wash my hair? How am I supposed to reach up and put things in the microwave? The only thing people kept telling me was, oh, have your husband help, have your husband help. Okay, well, what if I were single? Or what if he were at work or taking care of our children or doing my half of the housework, etc.? He couldn't be on call at all times for showering assistance or for everything that I needed to reach up for. And no one can. So in the beginning, he did help me with, for instance, washing my hair. That was a little disastrous. He is a cutie, but it would be fair to say he was not blessed with a head of abundant hair. And I, on the other hand, have enough hair for 3 people. So it just didn't occur to me that he wouldn't really know how to wash it very effectively. And it ended up with way too much shampoo, me being shivering and having prune feet, my hair still being a mess, and him being really frustrated that he didn't go the way he wanted it to go. So it it just didn't occur to me that he wouldn't know how to wash my hair. So take note, if your partner, whatever their gender, does not have a lot of hair, then you may want to either provide some instruction or figure out another solution. And for me, it motivated me to find a self-wash solution for my hair, among other things, because um, psychologically, it was also very important to me to be able to reclaim my ability to do stuff and not have to depend on other people. So it's more than just a matter of convenience or a matter of not having help. It's also a matter of reclaiming your ability to do things, which can be very important for psychologically, mentally, emotionally, and that has a huge impact on your recovery. I'll do another video about setting up your home so that with the whole reach and bend thing when you can't reach or bend based on whatever surgery you had, and I'll do another video that helps people set up for that. But this one specifically on hygiene. So for my hair, my solution to the hair washing dilemma and not being able to put your arms up begins the night before surgery. So when you go in for surgery, you'll be asked to put your hair up in this weird shower cap thing before they start the anesthetic. And this will keep your hair out of everything during the surgery. And it also helps to keep your body temperature up because the operating room or operating theater, depending on where you live, is really cold. And you just don't have anything on but surgical drapes, and it's freezing in there. So if you go for a messy bun before surgery, by the time you are sent home, especially if you have a hospital recovery where you're there for several days, you are likely to have a giant mat in the back of your skull that will be a terrible mess to get out. And the curlier your hair, the mattier it gets. When I was unexpectedly put in ICU, I did not have time to do my self hair, my do-it-yourself hair solution, and I did end up after 3 weeks with a massive mat in the back of my head, and the nurses couldn't get it out, and they were wanting to cut it. My husband's like, "Nope, we're not cutting it." Like, I think it's okay. I think we can cut it. Like, no one's gonna notice. But he was determined. And when I finally got put in my private room after I got out of ICU, and I was able to start, get on the road to recovery more, and I was out of the woods, I had a shower in my room, and so he put the shower bench in there, and he got a bottle of conditioner, and it was a long way. I just sat there on the bench for like a very long time. Nurses were coming in, like they left a pair of scissors, like just in case you drain your mind. He's like, no, I'm not giving up. He got the mat out, but I don't recommend this. So the best solution that I can find is pretty simple. It's just braids. It's side braids. Some people call them milkmaid braids or like the Pippi Longstocking braids. So if you already have your hair braided as a protective hairstyle, you're all set. But if not, then the night before surgery, I recommend doing the following. You're going to be asked to take a shower with antibacterial soap, and then after being dry for a bit, you're going to be asked to wipe your body down with these pre-surgical wipes. During that process, I very thoroughly wash my hair, and then I part it straight down the middle, and then I brush it out and put in two side braids a la Pippi Longstocking. And when I go into surgery and they give me that cap, I just fold the braids right into the surgical cap, easy peasy. When I'm out of surgery and I am home, and I'm ready to, it stays in the braids first of all, so that for the first couple of days, because you can't shower right away. It's like 48 hours about before you can shower because they want to prevent infection. It stays in the braids and it doesn't get tangled up and it doesn't get matted up. And then when you are ready to go in and wash your hair, you just take the braid out, and then you have a hairbrush in your hand. You're brushing it all the way, but look at my arm. It's not going up over my shoulder. I'm not reaching. I'm not having to get to anything. I'm just tilting my head and brushing each side out. And then in the shower, I just turn to the side, wash one side, condition, wash the other side, condition. Then when I get out, same thing. I'm just towel drying it. Sometimes if I have energy, I'll dry it with a diffuser because it's wavy and curly and can get really frizzy if I don't. But I just braid it. I usually don't because I'm too tired. Wash it and then just braid it down each side. And so you can continue to keep those side braids in. They're not the most attractive thing in the world, but they're far more attractive than getting a mat in the back of your head. So that is my easiest solution, is definitely braid your hair before the surgery and test out, if I'm going to care for this braid, can I do this without lifting my arms up too high? Because even though they say don't lift your arms over your head, even lifting them up as high as your shoulder height can be painful depending on the type of surgery that you've had. So for skincare post-surgery, when you have a major surgery, something really weird happens to your skin. It doesn't matter if you're male, female, anything in between spectrum, whatever you are, it doesn't matter. If you are a human being and you have skin, weird things will happen. And I did not expect this. And it can get really oily, like teenage weird oily. So on my second day home after my first really big surgery, I noticed I had like high school era oily skin, and I'm like, what is all of this? And apparently undergoing a major surgery and having general anesthetic can temporarily play with your hormones. It will most definitely mess with your skin barrier because you are having to wipe everything off with this antibiotic wipe, and because or antiseptic wipe, sorry, and because they're just putting betadine, they're putting surgical cleaning solution all over you. This is going to make a mess out of your skin. It's going to be totally off balance. It's only temporary. It goes away. It went away for me about week 3. And you may have a different level of oiliness. It may last longer or shorter. Everybody is different. But how I handled this is I maintained my regular skincare, but I washed my face 3 times in a row. Normally, if you wear makeup, you would do a makeup removal and then do a face cleanse. But I did 3 times. I did this morning and night. And I just used Cetaphil cleanser. Cetaphil is not paying me to say that. I have no Amazon storefront. There's nothing like that. It's just, that's what my dermatologist recommended. So that's what I use. So you can use whatever you like. But that's what I use. And the link is below, and it worked really well. And it just helped to keep everything balanced out. And I found that using clean skin cloths, so the like disposable wipes to wet and face washes to wet and wipe my face was easier than bending over the sink when I had abdominal surgery. And you don't have to use those disposable ones. You can use a washcloth too, just a regular old-fashioned washcloth. You can just get warm water and put it on your face, and then put the cleanser on, and then get warm water, and then wipe it off your face. Then you're not bending over, like splashing your face with water. So I just used a washcloth, and it worked just fine. And also having that wet washcloth and the cleanser, having a little bedside kit was very helpful to me. So when I was in the hospital recovering for a while, I would have like a makeup bag, but it didn't have any makeup in it. It just had a little travel sized Cetaphil cleanser and moisturizer, and the washcloth, and a tiny little spray bottle that had some rose water in it, so that I could ask the nurse to get me a warm wet washcloth. She would give me the washcloth, wet my face, cleanser, wash it, do that a couple times, spray my face with the rose water, and then moisturize, and that's it. And being able to do that in the hospital was psychologically very satisfying. But also having that at home by my bedside was helpful as well. And then I could go into the bathroom before I went to bed and do like a larger skincare routine. You may have one that you choose to have more steps, or it could be more complicated or less complicated, whatever works for you. But I do recommend putting together a little bedside skincare kit to take with you to the hospital, but also to have near your recovery area when you arrive home, because that can help you feel better to be able to take care of your skin, especially if you are having to wait for someone to get up and help you back and forth to the bathroom. If you wanted to help a loved one who is having a major surgery or has a diagnosis where they can't get around very easily, asking what products they use and if they might like a bedside skincare kit is also a great way to help them like prep for surgery and prep for recovery, and just one less thing that they have to buy for themselves. So that's also an option for helping out. Something else to consider for your skincare is that because the surgical team and the aftercare team will attach heart rate monitors to your fingers and your toes, sometimes, depending on the situation, you won't be allowed to go, or usually you're not allowed to go into surgery wearing any nail polish, because it can interfere with the sensors taking your oxygen level and your pulse during surgery. So if you're thinking that you're going to come home and quickly like redo your nails immediately, I thought that once too. It was a little pie in the sky, and by leaving my nails long in hopes that I'll come home and I'll do a manicure when I get home, it wound up making my wound care and my other post-surgical challenges more difficult. So I just recommend not doing that. Of course, it's up to you. What's important to every person is different. So maybe you want to leave your nails long. I recommend taking off all nail polish and just trimming your nails very short, and just wait. By the time you're fully recovered and you're ready to get another manicure, they'll be grown out. So I just recommend, unless you're really determined about your mani-pedi, just taking everything off, trimming it down, and keeping a little manicure kit by your bedside, just like your skincare kit, so that you can keep your nails smooth and short, and it'll make it easier for your wound care, changing bandages, and other post-surgery challenges. I also keep by my bedside, in addition to my skincare and my mani kit, hand cream, because your hands might get really chapped, especially if you're washing them all the time when you're doing wound care or cleaning your drains. Hospitals are always very dry environments. And ChapStick, mani kit, skincare kit, ChapStick, hand cream, very handy bedside items. So something else that you might not expect post-surgery is cotton mouth, which is really extreme dry mouth where it's like painful and you can't even swallow, and all you can think about is, I need ice water. Or something. You need something to drink. Americans love ice, so maybe you don't want ice water, but I want ice water. Um, Certain medications can make you have a really dry mouth, and while you do want to stay hydrated, you don't want to drink so much water because of the dry mouth that you're getting up to pee really frequently, more frequently than you would normally, and you're stressing out your incisions. Also, depending on your hospital experience, you may find yourself in a position where you are not allowed to drink and you can only have ice chips or IV fluids. I've been in that situation many times. This is really miserable when you cannot drink anything and you're just on ice chips. But what got me through this, both at the hospital and at home, is a mouthwash called Biotene. So Biotene is a mouthwash made specifically for dry mouth. Most hospitals will stock it. So if you're admitted for several days and you find that you're having this really bad dry mouth, and they're like, no, we're not bringing you any more ginger ale, or we're not bringing you whatever it is that you want, you can ask them if they have any Biotene. And most people are surprised. They're like, what? I'm like, yeah, can you just check in the back? You probably have it. Can you just check for Biotene? And they're like, hey, we do have it. No one's ever asked for that before. But this really got me through a very tough time where I wasn't able to eat or drink for many days. And you just use it, just pour it in a little cup, swishel, and spit. That's it. And it's a lifesaver. I love Biotene. Not getting paid by Biotene. And you can get it at most major drugstores as well. So you can have it when you get home. And sometimes they'll even just give you the bottle when you leave the hospital, because they're not going to use an opened bottle on another patient. It's not sanitary. So you just need to take it home with you. So we talked about hair, managing the hair, face care, some oral care, nails. When it comes to body care, the simpler the better. I found that moisturizing bars and shower gels that I usually use would leave a strange film on my skin and cause a lot of irritation after surgery. And I usually love a robust fragrance. I am not afraid of fragrance, but I found that after surgery, I was especially sensitive to chemically odors. So eventually I just settled on a clear lavender shower gel from the local health food store. It wasn't, the simpler and fewer ingredients, the better it was for my skin. You may have a different experience, but I do suggest purchasing a small bottle of something really basic, a gentle shower gel or basic soap, in case you find that you cannot tolerate your normal products for those first few weeks. And that went away for me. It didn't last. I'm back to my heavily scented ways. I'm back to my robust fragrance. But in the beginning, you may want to consider having that around just in case you find out, hey, I really can't use that. And one of the best products that I have found for showering post surgery is an exfoliating strip. This is a very gentle exfoliating strip. You do not want to go at yourself and start scrubbing hard, and you most definitely do not want to start scrubbing your incisions. That would be a bad idea. But just gently washing every area but your incisions with that will help your skin from getting really itchy, and it will also help to get rid of all the glue. I found that I had glue, like my whole chest at one point when I came home was just this massive smear of glue from all the heart monitors, and I don't know what all they had stuck in various ports and needles and everything. My arms and my chest were just covered in glue. It was so gross. And you're just covered in sticky stuff. So having that exfoliating strip to just gently work away at that was very useful. And also, here's a tip to get rid of some of that glue, is I would take just a cotton pad and put olive oil on it. And sometimes I just like gently rub the olive oil on my skin to just get that glue off before I got in the shower, and then use the shower gel and that with the exfoliating cloth, And it took a little bit. It didn't all come off the first shower, but it did get the glue off after 2 or 3 tries. So if you've been in for a while, you're likely to have some glue left behind. So just to sort of tie it all up, my routine from start to finish for personal hygiene is I found that being really organized helps me to get it in and out of the bathroom more quickly. Before I got started, I would set up all my new garments, my pajamas, my new bandages that I would be putting on after my shower, any compression garments that I was wearing, I would set all that up first. Then I would take off all my compression garments and bandages I had on, and I'll do another video on compression garments, and put them in the washing machine. Get that started. Then I would take out my braids, brush out my hair, get my clean towels set up, and get the water the right temperature. And that's really important, especially if you've had a major surgery like a breast cancer surgery, or where anything's been removed from your body, because it's going to cut nerves, and you're going to be numb, and it can take a while sometimes for the anesthetic to wear off, the anesthesia to wear off. So you can burn yourself because you just can't feel how hot the water is. So with a non-cut body part, your elbow or your arm or something, like, feel the water temperature. And once it's right, then get in, hair first, then face, then wash the body, then get out, pat dry, braid hair again, then clean and rebandage the wounds right away. After the wounds are dried, cleaned, dried, and rebandaged, then I would do, deodorant, skincare, all of that stuff, and put on my clean garments. So just some tips for hygiene methods and products, and some funny stuff to look out for, like the oily skin when you come out of surgery. So hopefully that helps you as you're preparing for major surgery and wondering how are you supposed to take care of yourself and what sort of things can you expect. And I will be back with another video soon. And until then, stay hopeful and take care of each other.